Good afternoon. In the chapter cell injury, now I'll be talking about the topic pathological calcification. The term pathological calcification means deposition of the calcium salts in the tissues other than osteoid or enamel. It is also called as heterotopic calcification because it is occurring in the sites other than the osteoid and enamel. That's why it is called as heterotopic calcification. And pathological calcification, it is of two types. One is dystrophic calcification, the other one is metastatic calcification. The term dystrophic means dead and degenerating tissues. So the deposition of if the deposition of the calcium salts is occurring in the dead and degenerating tissues, it is called as dystrophic calcification. And we divide this dystrophic calcification and metastatic calcification based on the calcium metabolism and serum calcium levels. And if in dystrophic calcification, the deposition of calcium salts occur in dead and degenerating tissues, and the problem is the problematic issue is with the dead and degenerating tissue and not with the calcium levels. So that's why the the calcium metabolism and the serum calcium levels are normal in case of dystrophic calcification. And the pathogenesis is still not clear, and few factors like alteration of the pH in the necrotic tissue, which favors the calcification, calcium deposition to occur, and some of the enzymes are released from the necrotic or degenerating tissues, which causes the calcium to be accumulated inside the dead and degenerating tissue. And there are two phases for this dystrophic calcification. One is initiation, the other one is propagation. In the initiation, intracellular or extracellular accumulation of the calcium will occur, whereas in propagation, the crystals formation is propagated. So idiopathogenesis, the calcification may occur in the dead tissues or the calcification may occur in the degenerating tissues. The examples for calcification occurring in the dead tissues is caseous necrosis. It is the most common, the characteristic feature for the cause for the caseous necrosis is infection with the tuberculosis, and the liquefactive necrosis, where the liquefactive necrosis will occur in the brain, infarct brain, and in the abscess cavity. Fat necrosis, which is due to trauma to the breast, or enzymes released in acute pancreatitis, which causes mesenteric fat necrosis, or it can be infarcts like myocardial infarction or splenic infarcts or liver infarcts or thrombi or hematomas. All these can undergo calcification. All these are dead tissues. We all know that necrosis is a dead tissue. Or again, it can be some dead parasites or calcification in the breast cancer or congenital toxoplasmosis. So calcification in the degenerating tissues, like examples, dense old scars, atheromas, monkey bug sclerosis. Monkey bug sclerosis is medial calcific sclerosis, that is in the vessel wall. The sclerosis will occur in the medial media of tunica media of the vessel wall. The sclerosis, that is calcification, will be occurring inside the vessel wall. It is called as monkey bugs medial calcific sclerosis, and the calcification may also occur in some stroma of some tumors, cyst or calcinosis cutis, or some. It can also be as a part of senile degenerative changes. Calcinosis cutis occurs just under the skin. So the calcification in the dead, it can be in the calcification in the dead tissues or calcification in the degenerating tissues. Calcification in the dead tissues can be either in the liquefactive necrosis or caseous necrosis or fat necrosis or some hematomas or infarcts or dead parasites, or it can be in the degenerating tissues like dense old scars, atheromas, monkey bug sclerosis, that is monkey bug's medial calcific sclerosis. It will be seen like bluish granular appearance, stroma of some tumors or cysts, or calcinosis cutis, or senile degenerative, as a part of senile degenerative changes also. This calcification might occur. Here in this picture, we can see some of the areas showing bluish or basophilic granular material. This is nothing but calcification that is pathological calcification. This is a serous cystadenoma of the ovary. Here we can see calcification in the form of psammoma bodies where there will be lamellated appearance of the calcified bodies will be seen. This is the tumor serous cystadenoma of the ovary. These psammoma bodies are also seen in other tumors like papillary carcinoma of thyroid, meningioma, and so on. And this is the aortic valve. These chalky white areas are nothing but the calcification. These chalky white areas, they hinder the action of this function of this aortic valve. These chalky white areas are pathological calcification. Mitral valve calcification. Here we can see chalky white area of the mitral valve. This is the pathological calcification again. Coronary atherosclerosis, that is atheroma also we can see calcification. This basophilic granular material associated with the cholesterol cleft formation here. And this is again the vessel wall. Within the wall we can see numerous areas showing calcified areas. Basophilic granular appearance, amorphous basophilic granular material. All this is calcification. Here, this thing is the calcification associated with the degenerative change. It's like cholesterol cleft formation. This is the coronary vessel showing calcification. Coronary atherosclerosis, that is atheroma. In meningioma, as we discussed, the calcium deposits are seen like psammoma bodies, that is lamellated structures. This is the meningioma. And this is the calcinosis cutis. This is the calcinosis cutis. This is the monkeybug's medial calcific sclerosis. This is a vessel wall. You can see within the media, tunica media, calcium deposition is seen. And this is the calcinosis cutis just beneath this skin. You can see numerous calcified bodies. This is the calcinosis cutis. This is the amorphous basophilic granular material. So the next comes metastatic calcification. Dystrophic calcification is the term itself is telling that it is occurring in the dead and degenerating tissues, whereas metastatic calcification, it occurs in the normal tissues, and here it is due to hypercalcemia. That is, it is due to excess mobilization of the calcium from the bone or excess absorption of the calcium from the intestine. So the calcium metabolism and the calcium serum calcium levels are more. Whereas in dystrophic calcium, there is calcium metabolism and the serum calcium levels are normal. Whereas in metastatic calcification, the tissues are normal, but there is abnormality of the calcium metabolism and hypercalcemia will be there. So they get deposited in the normal tissues. So the cause for the excess mobilization from the bone are more common. This includes hyperparathyroidism, which can be through hyperthyroid adenoma or hyperparathyroidism, where the causes can be parathyroid adenoma or parathyroid hypoplasia. And the parathormone helps to maintain the levels of the calcium either through absorption, resorption from the kidney, or absorption from the intestine, or resorption from the bone. Through this, the parathormone will try to maintain the calcium levels. When there is hyperparathyroidism, the parathormone will be more, so there will be excess mobilization of the calcium from the bone. So, and also bone destructive lesions also causes excess calcium in the serum. Like it can be due to multiple myeloma where punched out lesions will be seen, and metastasis. In metastasis also there will be hypercalcemia. And prolonged immobilization also causes hypercalcemia. And excess absorption from the gut, hypervitaminosis D, milk alkali syndrome, hypercalcemia of infancy, and all these things that there will be excess absorption of the calcium from the gut. So there will be increased calcium levels. They go and get deposited in the normal tissues. Like here, the common tissues involved in case of metastatic calcification are kidneys, lungs, stomach, blood vessels, and cornea. So excess absorption from the gut can be due to hypervitaminosis D, milk alkali syndrome, hypercalcemia of infancy, organs, and the organs commonly affected are kidneys, lungs, stomach, blood vessels, and cornea. Whereas in dystrophic calcification, dead and degenerating tissues are more commonly affected, whereas in metastatic calcification, normal tissues are affected. And examples for this metastatic calcification include ossification of the stylohyoid ligament and myositis ossificans, where there will be due to the muscle tissues, the soft tissues will undergo ossification, which leads to the formation of myositis ossificans. So this is an example of the X-ray showing soft tissue is replaced, soft tissue is showing metastatic calcification. This is an example of myositis ossificans. Metastatic calcification of the kidney. Here we can see these structures. These are nothing but amorphous basophilic granular material in the kidney. These are the tubules of the kidney. Some blood vessels are seen. These are the calcified areas seen in kidney. So this metastatic calcification occurs in normal tissues like kidney, cornea, lungs, etc., blood vessels, etc. So the cell, these are some of the questions. What are the cell changes? What are the types of calcification? That is pathological calcification, and types. That is one. The type is dystrophic calcification. The other type is metastatic calcification. And the examples for the dystrophic calcification are calcification occurring in fat necrosis, liquefactive necrosis, and caseous necrosis, and hematomas and thrombus and dead parasites are the examples. And whereas metastatic calcification, it occurs in the normal tissues, and the calcium metabolism will be abnormal, and there will be hypercalcemia will be there. And the causes are milk alkali syndrome, hypervitaminosis D, and hypercalcemia of infancy, and organs commonly involved in the calcification, metastatic calcification are kidney, cornea, blood vessels, lungs, etc. And what the types of Jane cells we see in tuberculous granulomas are the Langhans type of Jane cells, where we will be seeing horseshoe-shaped arrangement of the nuclei. And whereas the foreign body Jane cells, we see haphazardly arranged nuclei. These are called the characteristic Jane cells we see in tuberculosis are called as Langhans type of Jane cells, where the granuloma will be described like it's a well outlined structure where there will be central caseous necrosis surrounded by epithelioid cells, and interspersed are a few Langhans type of Jane cells with horseshoe-shaped arrangement of the nuclei surrounded by a collar of lymphocytes. And the calcification types are dystrophic calcification and metastatic calcification. And dystrophic calcification, the problem is with the tissue where the calcium metabolism and the serum calcium levels are normal. Whereas in the metastatic calcification, the problem is not with the tissue. There will be calcium levels will be more. It can be due to hyperparathyroidism or excess absorption from the gut, like hyperparathyroidism, which can be due to parathyroid adenoma or parathyroid hypoplasia. And whereas there is no problem with the tissue. And examples for metastatic calcification are myositis ossificans. Dystrophic calcification means the name itself is telling that calcification occurs in the dead and degenerating tissues. And what are types of necrosis? There are 5 types of necrosis: caseous necrosis, coagulative necrosis, liquefactive necrosis, fat necrosis, and fibrinoid necrosis. Coagulative necrosis is the most common type, and it occurs in the solid organs like kidney, heart, liver, and spleen. And liquefactive necrosis occurs in the CNS and abscess cavity. Caseous necrosis occurs in the tuberculosis, And fat necrosis occurs in the breast trauma cases, and acute pancreatitis, where there will be mesenteric fat necrosis, and fibrinoid necrosis occurs in the immune vasculitis. So all these are the examples. And what are cell changes we see in necrosis? The cell changes in necrosis are nuclear changes. We'll be seeing cellular changes like indistinct cell borders will be there, moth-eaten appearance of the cell, increased eosinophilia, and cytoplasmic nuclear changes like it can be either in the form of karyorrhexis or karyolysis or pyknosis. All these are the changes we see. So calcification, dystrophic and metastatic calcification, and the examples. Uh, Thank you.